Welcome to CareWise Senior, where we empower you with vital health knowledge. Today, we're tackling a topic of paramount importance for men over 50. Stroke symptoms you should never, ever ignore. Stroke is a leading cause of long-term disability and death. Yet, its early warning signs are often missed or dismissed, especially by men. Consider Tom, a 8-year-old retired architect from upstate New York. Active and seemingly healthy, Tom recently experienced a sudden, brief spell of confusion and a slight numbness in his left arm that resolved within minutes. He attributed it to stress from a home renovation project, telling his wife, Sarah, "I just need more sleep." This common oversight is precisely what we aim to address today. This video isn't just about statistics. It's about equipping you with the knowledge to recognize these critical signs, not just for yourself, but for your loved ones. Understanding these symptoms can be the difference between a full recovery and a life-altering disability. Let's dive deep into what every man over 50 needs to know. Before we delve into specific symptoms, it's crucial to understand what a stroke is and why rapid response is paramount. A stroke occurs when blood flow to a part of your brain is interrupted, either by a clot blocking an artery ischemic stroke, about 87% of cases, or by a blood vessel rupturing and bleeding into the brain hemorrhagic stroke. Without blood, brain cells are deprived of oxygen and nutrients and begin to die within minutes. This is why medical professionals often use the phrase, "time is brain." Every minute that passes without treatment during a stroke, millions of brain cells are lost. This loss can lead to permanent damage, affecting speech, movement, memory, and cognitive function. The faster blood flow is restored, the greater the chance of recovery and minimizing long-term disability. This principle underscores the gravity of recognizing symptoms immediately and acting without hesitation. Ignoring a transient symptom, as Tom initially did, can have devastating consequences if it signals a larger, impending event. Most people are familiar with the acronym FAST, which stands for face drooping, arm weakness, speech difficulty, and time to call 911. These are the most common and recognizable signs of a stroke. Let's break them down in detail. First, F for face drooping. Ask the person to smile. Does one side of their face droop? Is their smile uneven? This asymmetry is a critical indicator. Next, A for arm weakness. Ask the person to raise both arms. Does one arm drift downward? Is one arm weaker or unable to be raised? This unilateral weakness is a hallmark. Then, as for speech difficulty, ask the person to repeat a simple sentence. Is their speech slurred or strange? Do they have trouble finding words or understanding what you're saying? This can manifest as garbled speech or difficulty articulating. Finally, T for time to call 911. If you observe any of these signs, even if they are subtle or transient, call emergency services immediately. Do not wait to see if symptoms improve. Remember Tom's initial experience? While his symptoms resolved, they perfectly align with the transient nature of a thanks in advance, a mini stroke, which is a dire warning sign that a full-blown stroke could be imminent. Even if symptoms disappear, seek medical attention. While fast is crucial, strokes, especially in men over 50, can present with more subtle or atypical symptoms that are often overlooked. These are the signs you absolutely must not ignore. First, sudden, severe headache. This isn't just any headache. It's often described as the worst headache of your life, coming on suddenly, like a thunderclap. It can be a sign of a hemorrhagic stroke. Second, sudden vision changes. This includes blurred vision, double vision, or loss of vision in one or both eyes, occurring abruptly. It's not just needing new glasses. It's a sudden, unexplained shift. Third, sudden confusion or trouble understanding. This can manifest as disorientation, difficulty following conversations, or an inability to process simple instructions. It's more than just a senior moment. It's a profound, sudden change. Fourth, sudden dizziness, loss of balance, or coordination issues. If you suddenly feel unsteady on your feet, experience vertigo, or have trouble walking or maintaining balance, without any obvious cause, this is a red flag. Fifth, sudden numbness or weakness, particularly on one side of the body, that may be transient. This brings us back to Tom. His brief numbness and confusion were classic signs of a transient ischemic attack, or Thanksing advance. A Thanksing advance is often called a mini stroke because the blood clot causing it is temporary. However, a Thanksing advance is a powerful warning sign that a full-blown stroke is likely to occur soon. Studies show that up to 40% of people who have a Thanksing advance will go on to have a stroke, often within days or weeks. Ignoring a Thanksing advance, as Tom initially did, is a critical mistake. If you experience any of these subtle symptoms, even if they resolve quickly, treat it as an emergency and seek immediate medical attention. Your brain is giving you a warning. Understanding the symptoms is only one part of the equation. It's equally important to know why men over 50 face an elevated risk of stroke. Several key risk factors become more prevalent or impactful in this demographic. Hypertension, or high blood pressure, is a silent killer and a leading cause of stroke. Over time, high pressure damages arteries, making them more prone to clots or rupture. Diabetes is another significant factor. High blood sugar damages blood vessels throughout the body, including the brain. High cholesterol contributes to atherosclerosis, the hardening and narrowing of arteries, which can lead to clots. Atrial fibrillation, an irregular heartbeat, significantly increases stroke risk because it can cause blood to pool and form clots in the heart, which can then travel to the brain. Lifestyle factors also play a crucial role. Smoking damages blood vessels, excessive alcohol consumption raises blood pressure, and a sedentary lifestyle combined with poor diet contributes to obesity and related conditions. Genetics and family history also cannot be ignored. While Tom considered himself healthy, his doctor later revealed that his family history of hypertension, combined with his recent stress and a slightly elevated cholesterol level, made his thanks in advance a very serious warning. It's a stark reminder that risk factors often accumulate silently. When you suspect a stroke, every second counts. Your immediate actions can dramatically influence the outcome. The most critical step is to call 911 or your local emergency number immediately. Do not attempt to drive the person to the hospital yourself, as paramedics can begin life-saving treatment on the way and alert the hospital, preparing them for your arrival. While waiting for emergency services, try to keep the person calm and comfortable. Do not give them anything to eat or drink, as their swallowing reflexes might be impaired, leading to choking. Loosen any tight clothing around their neck. If the person is unconscious, gently roll them onto their side to prevent choking on vomit. Note the time the symptoms first appeared, if possible. This information is crucial for medical professionals, as certain stroke treatments, like thrombolytic drugs, are time-sensitive and must be administered within a specific window, typically 3 to 4.5 hours from symptom onset. Providing clear, concise information to emergency responders can save precious minutes. Remember, acting quickly and appropriately is your most powerful tool against stroke. While recognizing symptoms is vital, prevention is always the best medicine. For men over 50, proactive lifestyle adjustments can significantly reduce stroke risk. First, manage your blood pressure. Regular monitoring, medication adherence if prescribed, and dietary changes like reducing sodium intake are key. Second, control diabetes. Maintain stable blood sugar levels through diet, exercise, and medication. Third, lower cholesterol. A heart-healthy diet low in saturated and trans fats, combined with regular exercise, can make a significant difference. Fourth, maintain a healthy weight. Obesity is a major risk factor for many stroke-contributing conditions. Fifth, adopt a physically active lifestyle. Aim for at least 150 minutes of moderate intensity aerobic exercise per week. Sixth, quit smoking and limit alcohol. These are direct contributors to arterial damage. Seventh, address atrial fibrillation. If you have an irregular heartbeat, work closely with your doctor to manage it effectively. After his thanks in advance scare, Tom underwent a complete lifestyle overhaul. He started walking daily, adopted the Mediterranean diet, and meticulously managed his blood pressure and cholesterol with his doctor's guidance. This proactive approach not only reduced his stroke risk, but also significantly improved his overall well-being. Prevention is a lifelong commitment, but the rewards are immeasurable. Even with awareness, certain mistakes are commonly made that can jeopardize outcomes. The first and most critical mistake is self-diagnosis, or attributing symptoms to less serious conditions, like fatigue, stress, or a senior moment, as Tom initially did. Dismissing a thanks in advance as mere stress can be fatal. Remember, any sudden, unexplained neurological symptom warrants immediate medical evaluation. The second mistake is delaying seeking help. Many people wait to see if symptoms improve, or they try to sleep it off. This delay can push you past the critical time window for effective treatments. Time is brain, and every minute matters. The third common error is driving yourself or having a family member drive you to the hospital instead of calling 911. Emergency services are equipped to provide immediate care and transport you to the most appropriate facility. The fourth mistake is not communicating all symptoms, especially transient ones, to medical professionals. Be thorough and precise when describing what happened, even if it seemed minor or resolved quickly. Your detailed account helps doctors make an accurate diagnosis. Avoid these pitfalls to ensure the best possible care and outcome. For caregivers, spouses, and family members of men over 50, your role in stroke prevention and response is invaluable. You are often the first line of defense. Firstly, Educate yourself on all stroke symptoms, not just the common ones. You might notice subtle changes in your loved one that they themselves dismiss. Secondly, be proactive in managing their risk factors. Encourage healthy lifestyle choices, help them adhere to medication schedules, and attend doctor's appointments with them if possible. Thirdly, establish an emergency plan. Know how to contact 911, have important medical information readily available, and know which hospital is best equipped for stroke care in your area. Fourthly, trust your instincts. If something feels off, even if you can't pinpoint a specific symptom, err on the side of caution and seek medical advice. Sarah, Tom's wife, played a crucial role. Despite Tom's initial dismissal, her persistent concern and the insistence on the doctor's visit ultimately led to his diagnosis of a thanks in advance and the necessary interventions. Her vigilance was life-saving. Your awareness and advocacy can make all the difference. To recap, we've covered the critical aspects of stroke awareness for men over 50. Remember the time is brain principle. Every minute counts. Familiarize yourself with the FAST acronym: face drooping, arm weakness, speech difficulty, time to call 911, but also, and crucially, learn to recognize the subtle, atypical symptoms that are often missed. These include sudden severe headaches, unexplained vision changes, sudden confusion, and sudden loss of balance or coordination. Do not ignore transient ischemic attacks like the one Tom experienced, even if symptoms resolve quickly. Understand your personal risk factors, including hypertension, diabetes, high cholesterol, and atrial fibrillation, and commit to proactive lifestyle adjustments for prevention. Most importantly, if you suspect a stroke, call 911 immediately. Your quick action can be the difference between life and death, between recovery and permanent disability. This knowledge is not just for you, it's for everyone in your life. We hope this detailed guide has provided you with invaluable insights. If you found this information helpful, please give this video a thumbs up, share it with someone you care about, and subscribe to CareWise Senior for more expert-led health content. Your engagement helps us reach more people with life-saving information. Don't forget to hit the notification bell so you never miss an update. We also encourage you to leave a comment below with your thoughts or any questions you might have. Let's build a community of informed and proactive seniors. Thank you for watching. Your health and well-being are our top priority. Tom's journey, from dismissing subtle symptoms to adopting a healthier lifestyle, highlights the importance of vigilance and prompt action. His doctor also emphasized that while men and women share many stroke risk factors, there are unique considerations for each gender. In our next video, we'll delve into how hormones after 50 increase street stroke risk in women, providing essential insights for the woman in your life. Stay informed, stay vigilant, and take charge of your health. We'll see you in the next one.